What's going on, ladies and gentlemen? It's your boy Nurse Bass with the next installment of Mastering ABGs, paid for and sponsored by YouTube. A collaborative effort to not only help you crush those arterial blood gas exams and questions, but to help you better take care of your patients in the future.
Are you listening? Nurse Bass. Beast mode. Grind.
So we've explained what an ABG is. We've explained exactly the physiological processes in our body that allow us to maintain normal blood pH levels. Now what I want to do is I want to tackle exactly how we use this tic-tac-toe method to solve arterial blood gas questions. So I wanted to take a quick look at each component of this table so that you can better understand the reason why it is methodically laid out the way that it is. So down here we've got the question portion. This is going to be the questions that I'm going to present to you guys, a little area to write that, and then a little area to write your answer. This right here is the actual tic-tac-toe board, but we'll get to that momentarily. Let's take a look at this top half first. So first, what we have over here on this left column, you have the three primary values which we've discussed that we're concerned with. The pH level of our blood, our CO2 level, which again is concerned with our respiratory system, and then our bicarbonate level, HCO3. And again, that is metabolic, primarily regulated by our kidneys, as we've previously discussed. Here we've got the acidosis column, and here we've got the alkalosis column. So first, let's go over these normal ranges. Again, to reiterate, a normal range for blood pH is 735 to 745. Normal range for CO2 is 35 to 45. Now let me explain, because this can throw people off. It's backwards. Why is it backwards? Well, just to touch on it, like we previously stated, anything above 45 on a CO2 blood reading is acid. Remember, CO2 is an acid. So anything above 45 outside of the normal range, you become acidotic. That's the only reason why it's flip-flopped here. And then our bicarbonate, our normal level is 22 to 26. So anything less than 7.35 is acidotic. And again, the reason this one is backwards is because anything above 45 for CO2 is acidotic, and anything below 22 for bicarbonate is acidotic. Then of course, right here in between that 735, 745, that 45 and 35, and that 22 and 26, all of that is your normal range. And then on the other side, your alkalosis side, a pH above 7.45 is alkalotic. A CO2 less than 35, too little CO2, is alkalotic. And then a bicarbonate greater than 26 is also alkalotic. So whenever we get presented with these questions, we're going to be given a pH, we're going to be given a CO2, and we're going to be given a bicarbonate, and we're going to go through and place them in our appropriate boxes. So let's just get right into the first question as to alleviate any confusion. So before we dive into the next series of videos, the next 3 videos, which are going to go in depth with all of the different kinds of questions you can see, I wanted to give you a practice test question so that you can see how we utilize this tic-tac-toe table to solve these ABG problems. So first thing we look at, we always look at our blood pH. This is what is going to tell us first and foremost whether we are acidotic or alkalotic. That's the first thing we're concerned with. Once we figure that out, we'll then use these other 2 pieces of information to tell us whether it is a respiratory acidosis or alkalosis, or if it's a metabolic acidosis or alkalosis. So let's use this first one. Blood pH of 7.35. 7.35 is not less than 7.35, and 7.35 is not more than 7.45. It's right there in our normal range. So what we'll do, we'll write our pH in the normal column. Next, we want to look at our CO2, 42. Remember, a normal CO2 is 35 to 45, but let's just take a look at this chart. 42 is not above 45, and 42 is not below 35, therefore it's in the normal column. So we'll write our CO2 in the normal column. And then our bicarbonate, well, we know that normal is 22 to 26. So it's important to know that when you're looking at this, don't say my bicarbonate is 22. I see 22 right there. Therefore, it must be in the acid column. No, don't forget your arrows. This is saying anything less than 22. So 22 is not less than 22. 22 is not greater than 26. Therefore, it also is in the normal column. So we'll write it in the normal column. And therefore, what we can see is our pH is in the normal column, and both our bicarbonate and our CO2 are as well. Therefore, we know that this is just a normal blood pH. We're going to get into much trickier questions, ones that are normal acid-base questions, ones that involve partial compensation, and then ones that involve full compensation. There's 3 different primary kinds of ABG questions you can get asked, so it's very important that you guys stick around and watch the rest of the video series. This was the basic rundown of the tic-tac-toe method of solving ABGs. We're going to go into much more depth in the subsequent videos. It's your boy Nurse Bass, and I look forward to seeing you guys there. Peace.